very good day to the audience. My name is Bryce, a third year medical student currently studying at the University Kebangsaan of Malaysia. Beside me is our esteemed and honored guest, Prof. Dr. Adawiyah Jamil, the head of dermatology, the Department of Medicine at HCTM, who is currently a consultant dermatologist. Welcome, Prof.
Thank you very much, Bryce.
So, welcome to the first episode of The Road Ahead, a new initiative created under the PERSIAP Editorial Board 2023 and 2024, which is aimed to explore specific pathways into specialization, especially in the medical field. So, without further ado, let's begin. Prof, would you be so kind to introduce yourself to the audience?
Okay, first and foremost, thank you very much to PERSIAP for the invitation. I think it is a very good initiative and a very good activity that is initiated by students themselves in UKM. Okay, do you want me to introduce myself as in personal or more of an academic way?
Both.
Okay, as you know, my name is Adawiyah Jamil. Adawiyah is a very old name, it's Arabic. My father named me. I was born in Raub, Pahang. There's not that many people from Pahang, if you notice. I went to school in Raub, obviously. My primary school was Methodist Girls' School. And then I went to boarding school, Sekolah Sri Putri in KL. Then I went to, what did I do? Oh, after that I did A-levels. My A-levels was in College Mara, that was in Cheras for 2 years. Then I went on to do medicine in University College Dublin. And following that, I started working. When I first started working, my housemanship was in Hospital Tengku Ampuan Afzan in Kuantan. At that time, our housemanship was only for 1 year, and then I spent about 2 years more doing MO-ship in HTAA Kuantan. Then I transferred to Hospital Putrajaya. From Hospital Putrajaya, then I went into to do my Master of Internal Medicine in UKM. I was here full time, so I started my Master in Internal Medicine in the year 2002. That took 4 years. Upon completion of that, I decided to quit the Ministry of Health and join UKM as a lecturer. So I joined UKM in the year 2006, right after I finished my Master of Internal Medicine. And I started doing my Master in Dermatology, which I finished in 2010. Since then, I've been working in UKM as a lecturer. Can I do anything else academically? Yes, I can. I could have done a subspecialty, meaning a subspecialty within dermatology itself, or I could have gone on and do a PhD. But I decided not to. I thought enough with the learning, and on with probably living and maybe teaching. So yeah, that's a long introduction.
Yeah, basically, but that was a good introduction, Prof. So, Prof, may I know how your educational background and also your training experiences throughout the years, how have they contributed to preparing you for your role as a dermatologist thus far?
Okay, I actually did not decide to become a dermatologist until the final year of my Master in Internal Medicine, because I have to say actually my first love or my first interest is actually internal medicine. I love internal medicine. I love the general medicine ward. And I thought of all, throughout what I've done so far, my best years as a doctor is actually while I was a registrar in internal medicine. Yeah, I really enjoyed myself then. So I decided, I did not decide to become a dermatologist until quite late. My other interests at that time were actually endocrine. And when I was a registrar, I was actually a cardiology registrar. Yeah, I was cardio registrar. My research was, my master thesis was actually on the sick euthyroid syndrome in patients with acute coronary syndrome. So it was a combined endocardio thesis. Yeah, so you might wonder why I was doing endocardio instead of derm. That is because I have not decided. So if you have not decided yet what you want to do, it's fine. Just take your time. Okay. why do I decide to do
Yeah.
dermato then? That's the big question. Okay, so actually, why I did dermato was because I wanted more of a life-work balance. That's basically, you know, what people usually say. Why you want to choose something other than your interest. Obviously, I do like dermatology right from the beginning, but the main reason that I chose it is because of I thought it would give me a better work-life balance. So has that been true? Unfortunately, not so much. Unfortunately, not so much. So if you ask me how you want to choose what specialty to do, I think it's best to follow your interests. The life-work balance actually comes later, and it doesn't really, I mean, obviously if you take dermatology, there's less emergencies and you don't actually have to work overtime so much. But still the amount of work that you need to do is basically the same. So if you're doing work, it's better to do work that you enjoy at the same time.
So, Prof, if I were to ask you if you had another choice to choose another subspecialty, yeah, what would you choose?
Wow, no one has ever asked me that. Let's see, what would I have done instead? I think most likely endocrine. Why? Yeah, endocrine, because most of medicine is basically, you know, medicine is like a jigsaw puzzle. You have patient, you have got pieces of things, you know, pieces from your history, pieces from your investigation, and what you need to do are actually, you know, put together all the pieces and come up with a complete set of a puzzle. So I think, yeah, and I think I enjoy that process.
Okay.
So endocrine is a lot of figuring out the numbers,
hormones.
Putting all everything together and coming up with something.
So, when was the moment that you decided you wanted dermatology? Was there a traumatic event, or like did something change, or was it too stressful during that time, during your time in cardio?
Eventually, yes. I did tell you that my best years were actually as a registrar, but it's also probably not
most tiring.
Yep. The most after we finished the final year of our Master of Internal Medicine, and then we did another 6 months of gazettement. But during that time, even though I enjoyed everything, but it was actually almost as if work was taking over my life. So that's why I decided I wanted to do something which is not as heavy. Yeah, and at that time it wasn't just the work as in physical work running around. It was actually the responsibility towards the patient. So it was the feeling of responsibility that I thought the responsibility was becoming a little bit too much at that time. So I wanted to do something which, you know, not that many, something where the mortality is not so high and the morbidity also not so high.
So has that been true?
The mortality, yes. The morbidity, no. Because actually, yes, and I've discovered the morbidity, no. The mortality, yes. But that's actually the main thing, the main reason why I decided to do dermatology. And the interest comes because when I was a junior MO in Hospital Tuanku Ampuan Afzan, I was actually put into dermatology. I was rotated into dermatology right after I finished my housemanship, and I was under Dr. Ong. So I had a year of experience as MO in dermato, and then subsequently when I went on to do my internal medicine, actually dermatology, the exposure for a lot of doctors are very, very limited. So when I went on to do my masters, even though I only had 1 year of experience in dermatology, but of all the people in my colleagues of the same batch, I had the best knowledge on dermatology, right? Like anything they don't know, they ask me. That's simply because, not because I was good, but because I had the exposure and all of them did not. So, because dermatology is considered a minor specialty, and most of the time it's not taught in undergraduates. In UKM, we are very lucky because you do get some teaching in dermatology, In a lot of other universities, there's not even an in-house dermatologist to teach.
Yeah, and it's apparent because you were the one who taught us, Prof. So, yeah, for the lectures.
I
So,
see, yeah.
Prof, what led you to study medicine in Ireland specifically?
Oh, why did I do medicine?
Yeah.
I did medicine because I was programmed to do medicine. When I was in standard 1, in standard 1, teachers ask you what you want to be when you grow up. Obviously, you are 7 years old, you don't know what you want to be. So I asked my father what I should be when I grow up. My father was a teacher. So he said, okay, I can put air stewardess. I don't know why he told me to put air stewardess. Yes. And he told me to put teacher because he was a teacher. My mother was a housewife. And then the third one, I forgot what I put, but I think I put policewoman. Simply because my best friend in standard 1, her father was a policeman. So yeah, that's what I put in my form when the teacher asked what I wanted to be. That was earlier on in the year, and towards the end of the year, obviously, the end of the year, who got first place in class? Me, obviously. So then my father just suddenly, my parents suddenly noticed,
You're smart.
Yeah, we have a smart child. So right from then, they actually programmed me to become a doctor. So it's such that when I grew up, I never thought about anything else. When people ask me, "What are you going to be, doctor?" Okay, that's all.
You say that's a good thing?
I don't know, but I followed them. I let myself be programmed because I hate maths. Oh, I absolutely hate mathematics. So I thought, okay, you become a doctor, there's nothing to do with mathematics. And again, I was wrong.
You're wrong.
So you see, I was wrong quite a number of times. So yeah, again. So I thought, okay, I'll choose medicine, no maths. Went to A-levels. Oh my God, the maths is much worse than the Form 5
Yes.
maths. There's applied maths, modern maths, and statistics.
Yeah.
Oh, I can't tell you how frustrated I was at that time. And I thought, okay, let's do it. So managed to do it.
So, Prof, why is Ireland specifically?
Oh yeah, I digress. Sorry. It was just simply because I got during our time scholarships were much easier to get. So I was actually sponsored by Petronas, and actually the sponsor chose where they want to send us. So it wasn't our choice. So that's how I ended up in Ireland.
Did you enjoy your time in Ireland?
Oh, that was the best. Yeah, that was the best. I wish I could do it again. I was not a very good student in medical school because I enjoyed myself too much. I was also not a very good student during A-levels, again, because I enjoyed myself too much. I remember 1 month before the exams, during A-levels, that was the only time I decided to sit down and really study. So when the result came out, I was very nervous. Yeah. When the result came out, I was very nervous. But yes, I still made it. Such that when the result came out and I know, when I know of the results, I actually, because at that time we used landline phone, phone. I was enrolled at home, called the college to ask for my results. Got the results. I was so happy because it was so unexpected. I actually ran out of the house and danced outside. That was how unexpected it was. But yeah, medical school I didn't do well because I was again playing too much. But I made it through.
That's great. So, Prof, compared to your colleagues in Malaysia and compared to your colleague in Ireland, how would you compare the medical training in these two countries?
Oh, when I think in terms of training, this is referring to obviously more than 25 years ago. In terms of training, the local people had more hands-on practical experience compared to us, because for us in Ireland, we were very limited in terms of the ability to do practical things. For example, withdrawing blood, we were not allowed to do that. And so when I came back and start working as a houseman, I can see what I was lacking at that time was my practical skills. But in terms of theory skills and all the rest, we were fine.
So basically, you would say that your colleagues who did their training in Malaysia got more hands-on. They were more good at
Yes, the practical skills, they were so much better. But the other difference that I noticed is we were more confident. Well, I wouldn't say like people who train locally are not confident, but I could see the difference in terms of at that time, obviously a long time ago, maybe not now, it doesn't apply. In terms of communication skills and the confidence, I think we had an advantage in that area.
Is it due to your time experiencing Western culture?
I think maybe because when we were there, we were very independent because of course no parents, nothing, just friends, and we had to take care of ourselves, and study alone, study at the same time. So I think the independence is there. So we were more independent, and that's why we were more confident, maybe.
Thank you, Prof, for your comprehensive answers for your basically your explanations on educational background and also your introduction. So moving on to the next question, Prof. What are the pathways that you're aware of if someone were to pursue the dermatological specialty? So basically, like maybe the pathway that you went through, any pathways that you're aware of currently?
Okay, so how to become a dermatologist in this country, basically. You need your basic medical degree, of course, and then you need a postgraduate qualification in internal medicine. So that can be MRCP, MRCP internal medicine, not MRCP PEDS. Okay, if you do MRCP PEDS, then you become a PEDS dermatologist, and the training is actually with the pediatricians, not with the adult
so it's different.
physician. Yeah, but if you are interested in PEDS, you can become PEDS dermatologist.
But can you become PEDS dermatologist if you become a dermatologist first?
No, because you have to become a pediatrician first, then only a dermatologist. Okay, so for the adult side, so basic medical degree, then Master of Internal Medicine or MRCP Internal Medicine. Then you can do for local, we have the Advanced Master in Dermatology UKM. That's a 3 years program, so you can do that. If you do not do that, then in the country there is no other options. But if you train overseas, then you can, if you are in the UK, then you can get their qualification, which is called the Certificate of Completion of Training, CCST. Okay, so the CCST is for all the subspecialties, specialties including dermatology. Otherwise, if you are in Australia, there is a different, I mean, you can train in Australia, you come back, it will be recognized, okay, but the training in Australia is a little bit different in terms that, if I'm not mistaken, you do not need a postgraduate qualification in internal medicine, but you have to have some experience in internal medicine. And the whole program for them, because it's a little bit longer. So if you are in the US, obviously, if you follow their own training program to become a dermatologist, and then when you come back, you will be recognized.
So basically, the main pathways are basically, if you want to do it in Malaysia, you have to come to UKM for training.
Yes.
Under you, Prof?
Oh, the training, because there's only 2 dermatologists in UKM, so, and basically almost all of the candidates for the Advanced Master in Dermatology are actually employed by Ministry of Health. So they actually train in the Ministry of Health themselves.
Okay. So the specialists at UKM actually you and also Dr. Mohan, right? Okay. So basically the pathways are, if you're in Malaysia, UKM, and also there's US, the UK, and also the Australia. These are the most most recognized and also well-known pathways, basically. So let's say if you were a medical student currently, and I'm sure that let's say if I were to think that I want to be a specialist in the future, what pathway would be the most cost-effective, maybe I wouldn't say easiest, but maybe like easier to get in, and also less stressful in a way, and also maybe faster pathway. Which one would you recommend to like any medical students who are looking for a specialty in dermatology?
Okay, when you finish when you graduate, you're going to most likely be working with the Ministry of Health, right? The most of the time people are more concerned about making it fast. I want to become a dermatologist as fast as I can. Unfortunately, because of regulations within the ministry, you can't make it too fast. It used to be that the doing MRCP is much faster than doing a master. But nowadays, because the MRCP has been made more structured, so it is all now not as fast. It's basically just about parallel in terms of the time.
So basically, you would say there's no easy path, basically.
Yes.
All of it is the same.
Yes. It's good if you can identify what you want to do right from the beginning and identify how to get there so that you can plan. Because for some people they're not sure, like me, right? I'm not sure until right until my final year of master in internal medicine. I still wasn't sure. So then people who are like me would take longer.
That's why you should watch The Road Ahead. So basically, so Prof, as you said, I wanted to ask what inspired you to basically specialize in dermatology, but basically you already explained that it's because you wanted a more stress-free life. And also, okay, so I'll skip this question. So next question. Do you have any research and also academic experiences involved related to dermatology? Of course you have. And how have they influenced your clinical practice?
Oh, okay. Yes, we have to do research as part of our job here in UKM. Because when you work with a university hospital, you don't just do clinical work. You are expected to teach and you are expected to do research. So that's the difference between working in a university and working with the Ministry of Health. So my interests in terms of research are actually eczema. So I have done quite a number of studies on eczema, and my other interest is actually photodermatology. How has my research influenced clinical practice? Unfortunately, because our research are small research, not big budget, multinational, multi-center studies. So the studies basically are small ones which may contribute some to clinical practice, but not in a big impact. One of the studies that maybe has got the biggest value is actually we did, this is just not me obviously, it was along with our student. So we actually came out with the normal range for photo testing for our population, because when people have got sun sensitivity or photodermatitis, meaning you've got a reaction to the sun, and then you want to do a photo test to see what is the value. So there is no cut-off value or normal range, because the normal range we can't actually follow Caucasian skin or even Hispanic skin or black skin, so we have to come up with our own. So that's what we did. That's what we did, and so now we can refer to that paper sort of for a normal range for our population.
So, Prof, regarding that, I heard from Dr. Azad that you're part of the head of the committee for allergy, is it? What is it called? There's a committee in Malaysia regarding allergies.
Oh no, I'm not. I am. Okay, we have a persatuan. It's called Persatuan Dermatology Malaysia. So I am a member of the persatuan, and the persatuan has got subcommittees. So basically, I was in the subcommittee of allergic contact dermatitis and also the subcommittee for research. But most of my my contributions other than to the university, which is like for outside, I actually am the committee for the NSR, the National Specialist Registry, So for all the applications, for those people who want to register as a dermatologist in the country, so we are the committee that go through the applications.
So would you say that how to say? Are you able to balance all that out with all this extra work?
Yeah, it's a lot of work. It is a lot of work. That's all I can say. It is a lot of work. You just have to do it. But most of my work has been related to actually the Advanced Master of Dermatology, because I'm the program coordinator. So I've been coordinating the program since I myself graduate from the program. I then have to coordinate the program. So I've been doing that for many years. So it's more of the academic side actually.
So Prof, in your opinion, what are the qualities and skills which are essential for success in the field of dermatology?
Okay, I think actually not. The answer is not just basically tailored to dermatology alone. It's actually for any specialty that you want to do. Yeah, that's how do I answer that? You know, we always talk about how we should look at a patient holistically, and everyone will tell you, yeah, holistic management. It get drummed into us, but really, I think everybody should embrace the holistic approach towards managing a patient, not just looking at their skin, but looking at how the skin actually impacts them as a person. Same like not just looking at a patient in terms of their HbA1c, but looking at why their HbA1c is not controlled, what is going on in their life. So yeah, I think whatever it is that you decide to do, remember, if you're treating a patient, try your best to go the holistic way.
I think, Prof, I think you did quite well in that regard, because I personally am a patient of Prof, and I would say that her treatment of patients is excellent. My personal testimony for that. Thank you so much, Prof.
Thank you very much. Thank you very much. If you maybe this is something that I pick up along the way, that I learn from other people, and I try to implement it myself. When you are with a patient, right? In order for you to get a good rapport with the patient is very important, so that when you have a good rapport with the patient, your management becomes easier in terms of you managing the patient and the patient agreeing to what you are managing them with. Okay, I think when you are with a patient, at that time itself, you must make sure to put the patient first. Put the patient first. All your interest is actually about the patient and nothing else. Just like when you're taking history, either in the ward or in the clinic, don't write while you're talking to them, or don't look at the computer when you're talking to them. Give them your full attention. Like now I'm asking you, you come to the clinic, okay, tell me what is your problem, okay, give your full attention.
So, Prof,
it makes a lot of difference, I think.
You're saying in order to be a good dermatologist, or even a good doctor in that regard, we're not just treating a disease, we're treating a patient. So we're going to treat the patient as a person, and we're going to treat it holistically. From all.
That's a very good summary.
Okay.
I couldn't have said it better.
Alright, thank you so much for that, Prof. So, moving on to the next question. So, as a former head of dermatology, and also as a current consultant dermatologist, how would you say, how are you able to manage your work-life balance in terms of, your clinical responsibilities, your teaching, your research, your administrative skills, the administrative responsibilities, and even your family? How would you?
I find it difficult. Maybe other people find it easy, but for me myself, I find it very difficult to actually do this. For the longest time, I tried not to bring work home at all. Yeah, in terms of like bringing work and doing work at home, like on the computer. For the longest time I tried to do that as best as I can, and then guess what happened? Fail. Because apparently there's just not enough time during the day to do all this work. Actually, I have no advice on that, how to do it, because I have failed to do it. It's just like because the work is just too much.
Has it impacted your personal life in big ways, or would you say it's still manageable?
Not really, because I would say that my immediate family, like my husband and my daughter, they are fine. They are fine.
They understand.
They're fine. Yes, they're fine. They understand.
But basically, Prof, you're saying that when we step into the medical field, prepared to be pet. Okay.
Yeah, that's true. That's true. If you're not going to marry someone who is also a doctor, then you make sure you find someone who will really understand your work. But having said that, how will we know, right? Just luck, I suppose.
So let's just see where life brings us. That's true.
Pray for the best.
Prof, so move on to the next question. May I know any challenges or interesting things that you have encountered in your journey to becoming a dermatologist, and how have you addressed them thus far?
Anything interesting? Okay. I think it's
maybe
about
interesting.
Maybe about the how aesthetics has become very common nowadays, cosmetics and aesthetics. Because when I first started doing dermatology, it wasn't as big as what it is now. I happen to not like aesthetics and cosmetics, and I am happy that I'm in the university, then I do not have to do it. Okay. But one of my, I would say, pet peeves about being a dermatologist is because I don't like aesthetics or cosmetics, and when I encounter patients who have those problems, I find it very difficult to empathize. Yes.
So you are more interested in the pathological side of dermatology instead of the aesthetic side. So what would you say that what are your thoughts on the aesthetic doctors in general, aesthetic clinics in general? Yeah.
I think society nowadays, right? There is a need for aesthetics and cosmetics, because conventionally, traditionally, aesthetic is not medicine. It's not under medicine. Traditionally, we know medicine, cardiology, nephrology, pediatrics, and all the rest. So aesthetic is something new. If you want to know about other new specialty like infectious disease, is new. So it's not a traditional discipline. Same like palliative care, geriatrics. These are all relatively new, and the newest is aesthetics. Some people even argue that aesthetics is not medicine.
So are you one of the people in that regard?
I would say I'm still undecided.
Okay.
Okay.
But so, Prof, would you recommend, not recommend, but basically, do you think that young dermatologists, basically maybe like young specialists currently who wants to become a dermatologist in the future, should they embrace aesthetics in their clinical practice as a dermatologist in the future?
I suppose it also depends on your interest, whether you are more interested in treating diseases, or you're more interested in aesthetics. Sometimes it's an argument whether is it a disease or not, and that's why people argue whether it should be under medicine or not, because we are treating variants of normal. So I suppose at the end of the day, it depends on what is your interest.
So as all of us know, the medical field, it's not an easy journey. Pursuing medicine is quite a tough challenge, and also quite a tough journey. So as a current consultant yourself, what would be the advice you'll give to new medical students, and also basically doctors currently suffering in their housemanships?
For everyone suffering in housemanship, there is an end to it, so don't worry. there's an end to it. So
There's an
you
end
just
to
have to go through it, and you know there's an end to it. But I will tell you, when I was a houseman, I cannot wait to become an MO. And then when I did become an MO, I cannot wait to become a specialist. When I become a specialist, I wish I was an MO again.
Is that bad?
Yeah, because okay, why I tell you why I decided to do a specialty is because when I was an MO, I find that there's a lot of things I do not know, and I have to consult the specialist. So I thought, okay, I want to know more. I want to know more so that I don't have to consult anyone else. Right? So okay lah. Then that's why I went into into Master of Internal Medicine, and after I become a specialist, then I realized, oh my God, yes, I do know more, but the responsibility is so much more. So it's the responsibility of a person's life that can be a little bit overwhelming for me. So I did find it a little bit overwhelming. So that's why I decided to do dermatology. So when you're a houseman, you are tired, but your tired is physical. You're doing all the leg work, running here and there, take blood and all the rest. You don't have to do the thinking. You have no responsibility. Whatever you don't know, you ask, and once you ask, it's no longer your responsibility. You go home, you sleep well. When you are a specialist, you go home, you do not sleep very well. Because you are responsible for all the decisions, and you have to think about, did you make the right decision? Did you make the right diagnosis? Yes. So
Prof, how would you describe the jump from HO to MO, and from MO to specialist, and from specialist to a consultant? How big of a gap there is in between the levels?
Oh, you know you are a consultant in the true word when nothing you read online, Google, or nothing in the textbook can tell you the answer to your problem in management. So for example, you have a problem in managing a patient, and then you are not sure what to do. So you look at guidelines, clinical guidelines, you look into your textbook, you look online, and nothing helps you.
Because you have already have the knowledge, is it?
Because you already have all the knowledge, and nothing will help you, and your decision is a consultant decision. That's when you know you are a consultant. When no one else can help you.
How many years did that take for
Oh.
you to
That took, when did I realize that? Was like, oh my God, yes, now I'm the consultant. I have to make the decision. No one is going to help me. Can't remember. Can't remember.
Basically, you gain the experience along the way. There's suddenly one day you realize that, is it?
Yeah.
It's a click. Like,
Because but I can't remember the exact time. There's no need to note it down, right?
Any wise words to future aspiring juniors who wanted to pursue dermatology in the future?
Okay. Like I said, interest is very important. But when you become a dermatologist, there's a certain perception towards the specialties. For example, let's say if you introduce yourself, you say, I'm Bryce, I'm a neuromedical specialist. Or you say, I'm a cardiologist. Compared to you introduce yourself like, hello, I'm Bryce, I'm a dermatologist. The perception is a little bit different. Like you yourself would have that perception, right?
People would assume that cardiologists and the neurologists, they're how to say, the cream of the crop. Maybe like they're the most prestigious positions to be in.
Exactly.
Yeah. So
yes,
in regards to that, what comments do you have about that?
Exactly. So a lot, even my own colleagues, they will say, oh, that's Adawiyah, she's the panau doctor. Okay. Okay. Oh, that's Adawiyah, she's the fungus doctor. Yeah. So and people always seems to have this perception that the dermatologist is not as clever.
Oh, wow. That is a very big bias.
Yes, there is this perception. It's what it is. It's what it is. So
would you say?
So you want to become a dermatologist, you have to have this. You must not let this. pull you down. And people don't understand how important a dermatologist is until they themselves have got a skin problem. Then they understand, because each can be worse than pain. I had a patient who had cancer, and then this really one of the patients that actually changed my own perceptions toward my own patients. He had cancer, he had nasopharyngeal carcinoma, so he had surgery, he had radiotherapy, and then he developed late onset eczema. So when he told me, "Doctor, I would rather have cancer than your eczema."
Because of the itching?
Yes. The eczema was actually impacting him more than the cancer.
Wow.
Yeah.
So that's when you know dermatology is a very important specialty.
I suppose so. Yeah. And just like then that patient told me to actually look at all my patients in a different way.
So basically, your advice to young dermatologists is basically don't let other people discourage you because of the social stigma of the hierarchy.
The hierarchy. Yeah, you're
and
right. The
also,
hierarchy and the perception of your own colleagues toward what you do.
Basically, do what you like, do what you want to do.
Yes,
Okay,
and don't let them pull you down.
Prof, so surprise question. Maybe what's your most memorable patient thus far?
Oh God. There are a few.
Maybe just
But
one or two interesting cases.
The ones that I remember are actually the ones that don't do well, and yeah, I don't tend to remember the success stories. Of course, when you treat someone and they recover, that is actually a job satisfaction. That's called job satisfaction. It gives you a certain kind of satisfaction from what you have done. But there are those that you can't do. You can't. I don't know. We do try to help them, but sometimes it's just not possible. Yeah. Are there any specific ones? There are, but I will not tell you today because I will get very emotional.
I understand. Then, other than that, may I know how would you deal with the grief of losing those patients, or maybe?
It's difficult. I know we are taught not to let all these things affect us, but they still do affect us to a certain extent. So yeah, I still remember my patients from when I was an MO, not just during derm. I remember my patients. Yeah, maybe I will tell you about this one patient. She had SLE since the age of 13. 1-3. Okay. She had kidney involvement, she had skin involvement, and she had low platelets. Basically, those are all her SLE manifestations. Despite having SLE since the age of 13, she managed to have 3 kids. At the age of 41, she developed psoriasis. So she still has her SLE, she's still on treatment, and now she has developed psoriasis. Then only she became my patient. So her psoriasis was very, very bad. We tried a lot of things, and then she was in and out of the hospital at the beginning. And then of course she was an exam patient as well. So
like me.
Yeah, so she had direct contact with me. Whenever she's flare up, she will tell me, and then whenever she comes to the clinic, she will bring her daughter. And at that time when she first came to us, her daughter was only 9 years old, and sadly her daughter developed SLE at the age of 12. And then the saddest thing that happened was actually at the age she died at the age of about, I think she was 48, and she died because of COVID.
So it's quite recent, is it?
Yeah, so you can imagine she survived SLE since the age of 13 only to die of COVID. And it is very, very sad because her daughter, she was, I think, 12, 13 when her mother died. Because they have my number, so she sent a WhatsApp message to me using her mother's phone to inform me that her mother has died.
So, Prof, regarding to okay, so as a dermatologist in Malaysia, so have you noticed any interesting trends or any differences compared to the global landscape, other than maybe aesthetics in general? Any, yeah.
Oh, okay. Yeah, I have to say the changing trend is actually aesthetics, because aesthetics is actually becoming big now, and everybody wants to do aesthetics, not just dermatologists, because in terms of aesthetics, there are plastic surgeons, there are the aestheticians, and then there are the dermatologists. In terms of other aspects of dermatology, is actually now is an exciting time for eczema because of a lot of new drugs, and also an exciting time for psoriasis, simply because development of new drugs. Prior to this, there was hardly any new treatment for these two diseases for many years. So yes, in terms of dermatology, exciting times for these two diseases, and the latest is actually eczema. Psoriasis had their turn like maybe 10 years ago.
Prof, personally, what do you think about the regulation of aesthetic clinics in general? Have you heard about maybe like the death of patients due to unregulated drugs, injections into the face, and that kind of stuff? So what do you think about that?
Oh yeah, we do come across those on the news, right? But actually, if proper regulations are followed, it shouldn't happen, because the Ministry of Health has very good regulations in terms of aesthetic practice. So if anyone is interested, there's even a book that they have come up with to outline what certain people can do. For example, dermatologists are allowed to do this kind of procedures, and then plastic surgeons are allowed to do this kind of procedures, and aesthetic doctors has got their own list of things they are allowed to do and not allowed to do. Even as dermatologists, there are certain things we are not allowed to do, which is better done by the plastic surgeons. So there is a guideline from Ministry of Health, and the guideline is very good. It's just that whether people follow the guideline or not. So if people do not follow, that's when problem happens.
I understand. Prof, regarding MOH, just now you said you quit MOH and to become a lecturer in UKM, right? So just a minor question about what was the reason behind that?
Why I actually decided to work in the university. Number one, at the time it was also the time I decided to do a dermatology. Back to I want more life outside of medicine, and I wanted to be more with my family. So that's why I decided I want to stay in one place rather than move around. With the Ministry of Health, usually you get move around. So I want to stay in one place, and there's no better way than to join university, because you can't go anywhere else, here or Bangi. That's all. Okay. So I decided to join UKM because I was already doing my master in internal medicine in UKM. Second was because a lot of people have told me that I can explain things very well, such that people understand, and they would say that, okay, a lot of people have told me that when I explain things, I make it sound very easy and they can understand very well. So I thought that's a good trait to have as a lecturer. So yeah, why don't you just try it? I don't actually love teaching really initially, because I never taught anyway. But once I started teaching, I find that yes, I actually like teaching. I would say quite a lot, because I find that teaching is very rewarding. Okay, even though the reward is only like give a lecture, nobody sleeps. That's very good. That's considered a success. But giving a lecture and see all the smiling faces full of understanding and eagerness, that's something else.
Prof, my last question for you for this interview would be, how would you rate your experience at UKM currently? Do you enjoy your time here?
I would say yes. I have very good colleagues in the department. The Department of Medicine is a good place where we are allowed to actually improve ourselves academically and also professionally. So I would say, I would say I like being in UKM.
Before we end the interview, Prof, do you have any closing remarks for the audience?
I think I'm just gonna say what other people would say as well, and most of the time when you hear it, like, oh, everybody says the same thing, and then because you're young, it doesn't sort of make an impact on you. But when you're older than me, then you remember, oh yeah, why people always tell me that when I was younger, why I never listened. And then now I'm older, then I understand, oh yes, they were so true. Okay, I will have to tell you, always put your family first.
Okay. Right. So, Prof, thank you so much for your precious time. Thank you for accepting this interview, and thank you for being the first guest on the road ahead. So basically, that's it for this episode. And so thank you, Prof. Tune in to the next episode. Bye.